I am Dr. Vikram from Chennai, India. I am a surgical gastroenterologist by training. I had a wide variety of training. I was trained in Bombay, I was trained in England, subsequently came back to Chennai, settled down where I have been practicing as a surgical gastroenterologist for over 21 years. I also taught at Ramchandra Medical College. I was a professor of surgery and an examiner for various universities all over India and in the UK. This morning I'm going to talk to you about piles. Piles is a common condition where the patient presents to us with painless bleeding from the anal canal. Patient complains of passage of blood with every passage of stool. Sometimes without passage of stool also there is passage of blood, and sometimes the patient complains of staining of the undergarments. Sometimes the blood loss could be so large so that the patient presents with iron deficiency anemia. Now, occasionally piles can be painful, that is if it gets infected or if it gets thrombosed. Most often piles presents as painless bleed only. Now, how do we diagnose piles? We diagnose it by examining the patient, by examining the abdomen and examining the rectum. A surgeon inserts the gloved finger into the anal canal to find out if there are any other masses felt, and then he inserts a small tube called as a proctoscope, with the help of which one can diagnose piles. But every time you diagnose piles, it is also necessary to find out if there is any other cause for bleed, like maybe an associated diverticula or an associated cancer. Hence, it is mandatory that we carry out a colonoscopy to find out any other associated symptoms. We also do all routine blood tests. We assess his cardiac condition before deciding on what would be the best line of management. As far as treatment goes, for early piles, what we do is a banding. Banding is wherein you insert a sterile, tight band around the neck of the pile mass or the hemorrhoidal mass and allow the pile mass to slough off, to fall away. Whereas this cannot be done for a larger pile mass or a later degree of piles which comes out and pops out through the anal canal. It also cannot be done for piles which are external piles. All these cases one has to do only surgery under anesthesia. The surgery can be conventional surgery or the surgery could be laser surgery. Both are done only under anesthesia. The preferable anesthesia is spinal or epidural anesthesia, as it gives a long duration of analgesia, and the patient is comfortable for almost one day after surgery and complains of no pain. So what surgery do we do? The commonest surgery that I perform is a laser hemorrhoidectomy, wherein with the help of a laser beam we remove the hemorrhoid and we also occlude the blood vessel that supplies the hemorrhoid. We find that with laser hemorrhoidectomy the patient recovers quickly from the procedure. He is able to go home the next day. However, with the passage of stool there could be some bleeding that persists for nearly 7 days. Occasionally pain can persist for 3 to 4 days. This is a common procedure and we are able to give a very good result for all our patients. Thank you.